Zoom. Ooh, we have gone live.
Good afternoon. I'm Ebony Martin with NAMI New Hampshire. This presentation is brought to you as part of the Onward NH webinar series, supporting the first episode psychosis or early serious mental illness initiative. Thank you for joining us today for today's webinar titled Early Psychosis, Recognizing the Signs and Getting Help. This presentation is being recorded and you'll be able to find it on the education page of onwardnh.org. In the next couple of days, you'll receive a follow-up email with links to both an evaluation and a recording. This is a Zoom webinar. Your camera and microphone are off. The chat is also off, but please enter any questions in the Q&A. My colleague Meredith Closey is with us to help field your questions. Today, we are talking about an important topic for those who are living with symptoms of early psychosis, their caregivers, and others who work with them in a variety of different ways. First, we will hear from Michelle Wagner, who will provide us with some understanding about what early psychosis looks like, and then we will hear from 4 clinicians who work on the HOPE teams. These teams are embedded in 4 different community mental health centers in New Hampshire. These teams work specifically with individuals living with symptoms of early psychosis and their families. And now I'll turn it over to Michelle.
Thank you, Ebony. We're almost at noontime, so I'm sure there'll be some people who are just hopping on now. Thank you so much for joining us for our webinar. And if you stop sharing screen, Ebony, I'll go ahead and start sharing mine. There we go. Hopefully you all can see that. Yes, head nods. We're good. Okay. So today we are talking about early psychosis, recognizing the signs and getting help. And I am first going to give you my why as to why this topic is important to me and why I would be someone here talking about it. So as Ebony shared, I'm Michelle Wagner with NAMI New Hampshire, and I got hired on 5.5 years ago to work on the first episode psychosis early serious mental illness state initiative. So FEPESMI is the acronym we use for that. And the reason that I took that position is because I am the mother of 3 adult sons. And when those 2 older boys of mine hit their early 20s, both of them developed mental health conditions. The oldest is diagnosed with schizoaffective disorder. So in June of 2010, he had a psychotic break. And even though I had worked as a nurse for many years at that time, I had no idea what I was doing. And that journey would take me back to school where I would get a master's in clinical mental health counseling and give me years of experience in dealing with early psychosis. So the terms that we're going to use, early psychosis, first episode psychosis, they're often used interchangeably, but when you hear the term FEP, that's referring to first episode psychosis, and that's when symptoms of psychosis first strike for an individual. So here's our outline for what we're going to cover today. Whose reality is it? Because when we're talking about psychosis, reality is a very important topic. And what is psychosis? That term gets thrown around frequently, and not everyone's clear on what psychosis means. So then we're going to talk about hallucinations and delusions, because once again, those terms get jumbled for people. So we'll do some clarification of that. What are the causes of psychosis? So there are many causes, and I'm here to tell you it isn't bad parenting. I struggled for many years feeling like I was to blame for my kids' mental health challenges. Now I know that's not true. They have health conditions. Why focus on early psychosis? It's a small percentage of people that are going to end up with this. but those people are severely impacted often, as are their families. So it's important to talk about it. Warning signs. The warning signs can seem kind of vague in general, but there are some certain things that you might want to keep your eyes out for. So we'll talk about those, and then managing situations, because this is not something that comes with a rule book for us. So trying to figure out how to help people who are dealing with that condition, and then resources. So the rest of the panel will go on to talk about the programs that we have in New Hampshire specifically for helping folks who have early psychosis or first episode psychosis. So we will move ahead. Whoops, I clicked too fast. Reality, I say it's in the mind of the beholder. Anybody ever had a dream where you woke up from that dream and you just had a hard time shaking it off? Strangely enough, last night I had a dream that I was in some rubber raft on some body of water and there were sharks that were chasing me. So I woke up this morning and I was feeling just kind of edgy and anxious. Obviously, I'm doing a webinar today, so it makes sense that I would have a dream like that. And the reason that I bring up dreams is because we all enter an altered state of reality when we go into the dream world. We don't think about it as that. And for those of us who don't experience symptoms of psychosis, we are able to come back out of that altered state. But to keep in mind, so I have the lion here and a pleasant picture, because that altered state can feel peaceful or it can feel really scary. So thinking about folks when they enter this altered state of reality with psychosis, it can go both ways for them. Oftentimes it's a very frightening place for them to be. So it's important for us to show up with compassion. So what is psychosis? First of all, it's a medical condition. It is this break from consensus reality. And how I describe consensus reality is, if you look at my sweater, folks at home and on the screen, um, color, I bet all of you would say it's black, if you can see it that well. So consensus reality would be that all of us would say the sweater is black. For folks who are experiencing psychosis, they are having beliefs outside of consensus reality and experiences outside of consensus reality. The reason for using this term is that it takes the judgment out of it. Rather than saying they're believing things that aren't real, the issue is it is real for them. The experience they're having is absolutely real for them. So thoughts, beliefs, experiences outside of consensus reality with psychosis. So they hear, see, believe things other people don't. And these thoughts are so entrenched for folks that you can't talk them out of it because it is their reality and in that moment. Hallucinations and delusions. Like I said, these terms can get jumbled in people's heads, and an easy way to keep them separated is that those hallucinations are senses. So what people see, hear, feel, smell, taste, those are hallucinations. When they're seeing people, inanimate objects that aren't there, hearing noises that other people aren't, hearing voices that other people aren't, those are the hallucinations. The delusions are the thoughts that people have that are outside of consensus reality. So my oldest son, when he had a psychotic break, thought that he was Jesus Christ. So that's a very clear delusion and seems irrational to other people. We tried talking him out of it, wasn't going to happen because those thoughts can be so entrenched with psychosis because it is that person's reality. We all have our own experiences of hallucinations. Anybody ever think they hear a knock on the door or hear someone calling their name? That's really common. So when we're thinking about this experience, as historically it has been, those people are crazy, that's wacko. We all have some form of these experiences, and to remember that. Worked as a nurse for a lot of years, so diagnoses are part of my language. So, is psychosis a diagnosis? And the answer is no. It's a sign or a symptom of something else. So I liken it to when people have a cough. So you can get a cough from COVID or allergies or a cold or a whole bunch of other things. The same is true of psychosis. It is a sign or symptom of some other condition. And signs are the things that we can see um, with a person. That's what the difference is. And a symptom is what a person feels inside. So that's the difference between signs and symptoms. Like blood pressure, if your blood pressure is high, the numbers are going to be the sign that the blood pressure is high, or if it's low. And if you're lightheaded, that would be the symptom. Nobody can see that, but you feel that. So what does cause psychosis? We do know that there are a bunch of genes that are related to it. So those genes can get passed on from parent to child. Trauma also can cause people to experience psychosis. Depends on that person's hardwiring, their sensitivity, what they've experienced in the world. So a traumatic event for one person could trigger psychosis, might not in another person. Substance use, they're seeing plenty of this. The emergency departments are filled with overdose uh, cases, and we know that substances certainly can contribute. We'll talk a little bit more about cannabis because that is one substance that can contribute to psychosis. Medications, even prescribed, taking them as directed, can cause symptoms. Physical illnesses, brain injuries, we know we see this with patients with dementia and also mental health conditions. Primarily, you're going to see psychosis show up when someone has schizophrenia spectrum disorders, bipolar disorder, major depressive disorder, can show up with anxiety as well, and also um, with trauma, as we said. So cannabis and psychosis, I'm going to read this. Recent research suggests that smoking high potency marijuana every day could increase the chances of developing psychosis by nearly 5 times compared to people who have never used marijuana. And what is the reason for that? The potency has increased. This is not the same pot that people were using in the 70s and 80s. In the 90s, the concentration of THC, which is the component in marijuana that gets people high, THC levels have increased dramatically. And the forms that people are using now, particularly young people, they can be close to 100% THC. So doctors and emergency departments are seeing cannabis overdose. And what we know is that people with a sensitivity to psychosis using marijuana can tip the scale for them. So if you've had an experience of psychosis, concerned about the tendency, marijuana is not a safe substance for folks to use. Why do we focus on early psychosis? What we do know is 3 in 100 people are going to have an episode of psychosis at some point in their lives. It could be any one of us. We know with COVID, they were seeing cases of psychosis. So it could be any one of us. But when it strikes with a mental health condition, it's often when folks are in their late teens to mid 20s. So when people are just starting to launch into their lives, they're now struck down by this condition. It's going to happen to 100,000 adolescents and young adults each year. We do know those numbers are probably going to increase. We know marijuana is going to fuel some of that, and just other conditions, including stressful situations. The issue is that treatment is often delayed 1 to 3 years. And the RAISE study that they did about a decade ago, they saw that it was almost a year and a half before people got in for treatment, because with their symptoms, they just kind of fly under the radar. And so what ends up happening, who does end up showing up first, it's often law enforcement, because there'll be some episode, might include violence, and that causes law enforcement to show up. if we can get in there and get treatment early for folks, we know that that makes all the difference, which is why the people from the HOPE teams are here to talk about their programs today. People of color in psychosis, we know that there is misdiagnosis, overdiagnosing. We know Black men are more often diagnosed with schizophrenia than is truly the case. Actually, it's post-traumatic stress that they often have, but get overdiagnosed. We know there are barriers to folks getting help, and that treatment providers, we know in this part of the country, there aren't enough opportunities for folks to find clinicians that look like them. As a person of color, if you want to also work with a person of color, that can be a challenge. And that lack of diversity and lack of knowledge can be tough for folks in finding help. Early warning signs. These can look a lot like a typical teenager, that they're may not shower as much as they used to. They may be withdrawing a little bit. It can look sort of like a normal developmental path. Yet, what I always say to folks is trust your instincts. If something doesn't look quite right, if you're a little bit concerned, follow up on that. We become concerned when people are now having trouble thinking clearly. What I've often heard, because I had co-facilitated a support group for families with early psychosis, loved ones with early psychosis, their loved ones, they're usually adult children, would have these really intense ideas, often spiritual in nature, and it looked like it could be, well, it was sort of normal, but not quite. So reality and fantasy can get blended together, and that is a cause for concern to have a little red flag go up in your brain. What we often say with people with serious mental health conditions, they're in denial. You might see these symptoms, you might see some psychosis symptoms in someone you love, and you're thinking, what is wrong with them? Why can't they see? They're denying that they have an issue. There is a term for what happens for folks. It's actually a medical condition. It's called anosognosia, and it's a lack of awareness or insight that happens for folks. It's frontal lobe involvement. There's something happening in their brain that causes their brain to not be able to update their self-image. They're seeing themselves as they were before their health condition struck. And it can vary over time. That awareness, that insight can come and go. And it's a common reason that people either stop medication and treatment or won't get into treatment at all. But it is a medical condition. It's not that they're just being obstinate or that they're in denial. They truly believe that they're okay. First episode, psychosis and violence, or early psychosis and violence. The media portrays it that folks with psychosis are dangerous. And I'm going to share some information here with you. A substantial proportion of patients in first episode psychosis commit an act of violence before they get into treatment. As we said, it's often a year and a half before they get treatment. This includes a number of people who may commit an act of more serious violence and may cause injury to another person. However, severe violence resulting in serious or permanent injury to the victim is uncommon in this population. For anyone who has heard Justice John Broderick share his story, he was harmed by his son. He did make a full recovery, and his son, who ended up incarcerated, is out and is living a very wonderful and productive life. So it's important for us to keep in mind, yes, there can be a risk for violence, which is why early treatment is really important. Yet, what we know is that people with mental health conditions are more apt to be victims of violence than perpetrators. This is another important topic when we're discussing early psychosis, because People with psychotic symptoms are more likely to harm themselves than to harm someone else, especially early on when someone is first experiencing psychosis. It can be such an overwhelming and isolating experience for people. And because in this culture we have not talked about psychosis and symptoms in a favorable light, people aren't apt to open up about it. So it can be really isolating and scary for people. So this is an important topic to consider. And a reminder, asking about someone's thoughts about suicide is really important. We used to think that you don't ask them whether they're thinking about taking their own life because we're going to prompt them to do it. That isn't the case. It's really important if you have concerns about someone's safety to ask if they're having thoughts of taking their own life. Who else is at risk? The person obviously with psychosis and also the social circle. There's evidence to show that people in the immediate circle can be at risk. So that's important to keep in mind if you are a loved one of someone with early psychosis, to pay attention. They're not being evil or cruel. They're doing what their brains, which have been hijacked by unbalanced brain chemistry, are telling them that safety is a risk. So to keep this in mind. And if law enforcement is necessary, to definitely reach out. So 911, and if you don't need law enforcement, to call 988. We're so lucky now to have this suicide and crisis lifeline. Please don't hesitate to use it. The crisis is as defined by the person. If you feel like it's a crisis for you or a loved one, don't hesitate to call or text that number. How else can you help? Do be honest, patient, avoid whispering, comply with requests if they're reasonable. People who are having this experience are often fearful and they're lonely, and they want to know that the people around them are safe. So doing all of these things can be really helpful. And if you're able to offer choices to people, that helps them feel a level of control. Don't joke around, challenge or argue, make any promises you can't keep, because the important thing is to build relationship and to build trust. And all of these things in the don't column are just going to push people away. Also, if people are hearing voices and or if their brain is really slowed down because they might be in a depressive episode, they're going to need extra time to process whatever is being said to them. So don't assume that they can't understand. They just may need some more processing time. What you can say, if someone says, I'm being followed by the government, they bugged my apartment, these are common concerns for someone with psychosis. You just want to get to the feeling, what's going on for them. That must be really scary. I can see you're upset. Marks on my arm are from the poison they're slipping into my food. Once again, you just want to get to the feeling. Somebody's really frightened. This is truly their reality. And if that was happening to any one of us, it would be really frightening. The newscasters on TV are telling me I should hurt myself or someone else. Why do they do that? Don't know, that sounds upsetting. Can I ask what the voices are telling you now? It can be really difficult for people to share that they're hearing voices because of the way we've always viewed it in this culture. But if they're letting you into that and you can treat it like it isn't a scary experience for you, they might be apt to give you some really important information. The other folks on the panel today are going to talk about the HOPE program, this coordinated specialty care model that we now have to help folks who are experiencing a first episode of psychosis. It's evidence-based, recovery-oriented. There is a team approach here. They wrap around, you see in that model, wrapping around the client. It helps reduce symptoms. It helps young people continue on with their lives. It's a really great program. And this is a list of those 4 programs that we have around the state. NAMI New Hampshire also has some resources for folks. We have an information and resource line. The information is there on the screen. Please call us if you have any questions, if you're not sure where to go. We can help guide you. We also can provide you with our internal resources that we have. We have a family support group for early psychosis. Ebony, who is leading us off today, she is one of the co-facilitators for that. We have educational programs, we have support groups, other support groups, and we have Connect Suicide Prevention programming as well. So we're happy to help here at NAMI New Hampshire. So the takeaways, hoping that folks have gotten out of this presentation, is that we need to normalize the conversation around psychosis. This is indeed a medical condition. It is a health condition. It isn't that people are behaving badly or doing something wrong or need to just pull themselves up by their bootstraps. A medical condition that we need to be compassionate about. Reality, that depends on the person. And when someone is experiencing psychosis, that reality is absolutely true for them. So to understand and respect that. The individual and social circle are most at risk. So do keep that in mind and get help if it is needed, 911 or 988. When you're speaking with someone, get to the feeling, the emotion. Oftentimes they're afraid, sometimes they're angry. So redirecting wherever you can and understanding the emotion that's fueling it. Cannabis, marijuana can be a risk factor. Do keep that in mind. And also that recovery is the expectation. I am so very fortunate that these two older sons of mine who have mental health conditions are very stable and leading productive lives at this point in time. I can tell you that there were many points over the last, 15 years it's been, in those first 13 with our oldest son, where I worried that he would never get better. And he is better. I have my son back. He's working as a peer support specialist. He receives services at one of these wonderful programs, one of the community mental health centers, and there is hope. So with psychosis, we want to connect the person and the family with resources. So us here at NAMI New Hampshire, also the HOPE programs. And with that, I am going to turn it over to Patty Driscoll.
Thank you, Michelle. And really thank you for sharing your personal story and how you've been impacted by mental health and the work that you and NAMI do to reduce the stigma and get the information and education and support and resources. So thank you, and thanks for the folks that are watching and listening today for your commitment to learning more about this. I'm going to talk today. I work at Seacoast Mental Health Center, and I'm the Vice President of Clinical Operations for our Adult Services Program. Our HOPE program falls under me. I'm the co-coordinator of our program. I'm going to do sort of a kind of a high level, brief talk about the importance of early detection and early intervention when it comes to people with first episode psychosis or early serious mental illness, as Michelle mentioned earlier. So, like other diseases, medical conditions, early detection and treatment that's based on and uses evidence-based practices is important when someone is dealing with a first episode psychosis as well, because as we know, psychosis is a medical condition. So illnesses with psychosis as a symptom, as Michelle mentioned, typically emerge in people in their late teens and early adult years. Studies show that prolonged periods of untreated psychosis will lead to worse outcomes for the individual. So it's really important that there's not just the treatment, because you have to do the detection, right, and identification, early detection of these conditions. So the research does tell us that there are many benefits to early detection and intervention for FEP. Specifically, to name, I'll name a few, but certainly that having that kind of treatment and being a part of mental health care, there's an increased chance of recovery. Some people can fully recover from psychosis. Improved quality of life. Certainly Michelle shared some of that about her sons. It's positive impact on functioning for folks. This model relies a lot on helping these folks with getting to work or school. We all know how important those two things are in someone's recovery. The early intervention also helps there be less severe symptomology for the individual because of the medication and the coping skills and the treatment that they're getting. It helps families, as Michelle talked about, navigate the difficult symptoms, provides them with tools, resources, coping skills. We do have another panelist who will be talking more about that, but it's really important for families and loved ones. It can minimize the need for inpatient hospital stays for individuals. It provides lifelong coping skills and strategies. Ultimately, the goal is to limit or reduce long-term psychosis and functional impairments for the individual. So what is early intervention? Well, there's two parts, as I mentioned a minute ago. There's early detection, and then there's early and quick evidence-based treatment. So early detection, that involves the ability to recognize the early warning signs, the red flags, and to get that person, hopefully be able to get that person to a professional for assessment as soon as possible, so that it can be determined what is the condition that, if there is a condition, what that condition is that might be causing that person's symptoms and the changes that that person's experiencing or someone is witnessing. So we need to know, right? So you need the diagnosis. So you need to get the person in for assessment as soon as possible. So part of the process of early detection has to do with the reducing the stigma, as Michelle talked about, and NAMI and all of the things that NAMI does to help reduce stigma so that people are willing to ask for help early on so they can get the help. And it also is about educating the community, educating all kinds of different entities in the community so that people that interact with other people, right, will be armed with information so that there's a more likelihood that a person might be able to get help if somebody else is recognizing and understanding, or at least just even wondering if something's going on. So early detection is really important. And then the treatment as soon as possible. And, pretty quickly, once there's a confirmed diagnosis, it's vital to start treatment and have that the individual and whoever's in their circle start in treatment. The HOPE programs in New Hampshire, the 4 of us, including my program at Seacoast, we participate in early intervention activities in many different ways. We do provide education on FEP in a variety of community settings, including hospitals, schools, primary care, with law enforcement, first responders. We partner and are increasing our partnership with NAMI to get the education about what early episode psychosis is, to a broader community, so that, again, you have educated people, you have people who know what to look for. We're more likely to get people help quicker. We also are doing and have done just marketing about our programs. The Onward New Hampshire website certainly has our information. And we try to, each center and as a collective, trying to get the information out there so that providers, families, individuals know that we exist as an option for them. So what else do we do? Well, one of the most important things I feel and beneficial is that some of you may know in community mental health centers, there can be, a lot of steps and a lot of hoops that you have to go through in order to be established as a patient and get care. Some of those are by our own design, and some are by the design of the people that, we contract with and that fund us. But we know that can sometimes present barriers for people. If it's too hard or too long to get help, and sometimes that window is really, really, really small, narrow window. So we have made decisions, those of us that are doing the HOPE program, that we're going to create different ways and different protocols for folks that we are assessing or have assessed that are in a first episode psychosis, where they're bypassing some of the processes that we have and are able to get in sooner. We have a rapid response or an outreach when we get a referral or an inquiry, and the referrals and the inquiries come directly to the FEP coordinators rather than going to our general telephone, line where they'll go through 3 or 4 people before they get to maybe the right person. So they come directly to us so that we can immediately start to look into what we're dealing with here. And there's many different ways that we do that. Our HOPE program coordinator will call whoever they get the message from right away, start asking questions. There's some very relevant questions to ask in order to start to determine what might be going on. So we get info from the impacted person, if that's the person we get to talk to, family or loved ones, current treatment providers, if they have them, if they're in the hospital, certainly we have conversations, medical records, as much as we can in as short a period of time. And then we do an intake. So the intake is scheduled, and it's not you're not getting in line and having to wait for an intake or come in during our open access hours and wait in line for an intake. You're getting an intake, sort of a fast track intake. And the first treatment that we look to get started or introduce is the psychiatry part, the medication part. So if you think about, as we've talked about, that psychosis and mental illness is a disease, right? And so medication is certainly a really important and vital part of managing symptoms of a disease. Psychosis is a symptom of the disease. So getting somebody connected right away with a prescriber who will meet with the individual and the family or whoever's involved and talk about the value and benefit of medication. It's not meant to overwhelm, it is just meant to, introduce the concept and to educate and to hopefully be able to get agreement that medication might be something that they're willing to be a part of. And then we have the rest of our coordinated specialty care team. And what we do is that we have the members of that team do very brief meet and greets with the individual, just to let them know that there's all these different services that we have available to them. And again, it's very person driven. So it's really up to the individual, what services they want. And some folks take everything that we offer. Some might just take the minimum at first and then add services as they go when they see that maybe these are beneficial and they're being able to be engaged. some folks aren't able to engage initially, but we can still wrap around the family, as one of our other panelists will talk about, so that the family is still at least getting education and getting support around their individual. So it's really, so it's really important that we do this as soon as possible, but we also do it frequently. If someone is hesitant about having a case manager, or someone's hesitant about the therapy piece, hesitant about seeing a peer, that's okay. We're not going to force anything, but we are going to, continue, if they are engaged with us in any way, meet them where they're at their pace, but always reminding them of what's available, so we revisit that frequently. And again, trying to educate and encourage, but we don't force people to engage in a service that they're not interested in. So information is really important. So we do share all the information that we have about external resources, because certainly our program and what we do isn't the be all end all. There's all kinds of external resources and supports, predominantly, through NAMI. But the idea, again, is to try to get the engagement as soon as possible, which is often hard with some of the symptoms that Michelle mentioned before. It's often hard to get someone, in that situation to be engaged, but we don't give up. And we continue to outreach. And then once the person's engaged, we follow the evidence-based practices that are part of the coordinated specialty care model. So I think that ends what I'm going to say. I will say that at Seacoast, we have been able to, our first 2 participants, when we first started providing this service, our first 2 participants just recently graduated. So they started with us and they stayed with us for the whole 2 years. Now, that doesn't happen with everybody, but I think it's important to say that. And I think the concept of our how we embrace the early part, and the early part with the family, really influenced that. And certainly the participants and their family shared that and agreed. So we're pretty proud of that. So thank you for listening to me. And I'm going to now pass you to Ashley O'Donnell, who's going to talk more about the importance of family intervention. Thank you.
Thank you, Patty. My name is Ashley O'Donnell, and I am a clinical supervisor and team lead of the HOPE program at the Center for Life Management in Southern New Hampshire. And I'm very pleased to be able to talk about the family education portion of treatment. Oftentimes in my role, I will get a first phone call from a family member, and I can often hear the anxiety, confusion, and frustration with them really just trying to take in what is happening with their loved one, seeing these new symptoms. So a major component to treatment is family education and support. It's understandable that relatives can respond to a loved one experiencing a first episode with a variety of emotions. And the family clinician is a part of the coordinated specialty care team, and their role is to provide education and support during this challenging time to the family directly, or support people. It doesn't have to be a blood relative. Support is really who the person experiencing these symptoms identifies. It could be a roommate, it could be a girlfriend, a boyfriend, a very close friend, whoever is really there in support of them. The rationale for the involvement of loved ones is the involvement of relatives is valuable. And research has shown that clients who maintain relationships with their loved ones during a first episode and have them involved in their care have better engagement and better outcomes in treatment. So with that in mind, the family clinician uses a collaborative process to help the relatives build on their strengths to create and maintain an environment to support the client's recovery. 7 of the primary goals of family sessions elicit information on the family's understanding of symptoms, causes, medication, and the impact of stress on the client's life. Provide education that addresses gaps in the participants' knowledge about psychosis, treatment, substance use, strategies to cope with stress, and the role of that the family plays in recovery. Really to help promote hope to the family members. Help them recognize the signs of a psychiatric disorder. Re- Reduce negative emotions in family members. They are also experiencing probably a lot of significant stress and anxiety during this time. Enlist family members' cooperation with the treatment plan. Keep, everyone on the same page, being that support. And also helping, monitor some of these symptoms. There's also some different educational topics that are discussed in these sessions. What is it that the person is experiencing? Knowledge is power. What are some options for medication? What are the side effects? Keeping the family educated as well in that. Supporting them with ways to cope with stress. Basic facts about different substances, healthy lifestyles, strategies to build resilience, effective communication, supporting to develop a plan to feel well, support to develop collaboration with other mental health professionals, and really just supporting them in the recovery. This is an ongoing process, so it's so important to have that family involvement. And not only for our Southern New Hampshire, but our Hope team, we've also seen people who are also in like the Manchester area as well, to really try and, provide that support as far as our reach will take us, as well as my other members from the other Hope teams. So, and I believe I am now passing things off to Heather.
Thank you, Ashley. I appreciate it. I'm Heather Carver. I am from the Greater National Mental Health Community Center. I am the FEP Hope Coordinator and also provide the family therapy. So I'm going to be focusing on the goals that we have related to our community outreach and education, which is one of the things that we focus on within our groups. So just real quick to summarize, 3 goals. First is we want to increase the number of people in the community that are going to recognize if they see first episode of psychosis. And additionally with that, we're going to be, as my other presenters have discussed, reducing the stigma that's surrounding psychosis, first episode psychosis. Second goal, ensuring as many individuals are aware as possible about the existence of a treatment that can help them through this experience. And then thirdly, to increase the likelihood that individuals are going to end up getting connected with an FEP or HOPE team. Once again, we talk about early intervention. The sooner we get individuals connected, the sooner we give them the support, the better the outcomes are going to be. And that's what we want to see. We want to see the best possible outcome. So I've broken down the goals, and I'll just kind of break each one down a little bit more. So increasing the number of individuals that recognize psychosis in the community. So basically what we do is we do outreach. Okay, we reach out to, I believe Patty mentioned hospitals, law enforcement, schools, and we try and educate them. And we try and educate them about first episode psychosis in a way that they're most likely to experience, that they're most likely going to see it. So my presentation to, for instance, a police department might look very different from how I'm going to present to a school. And it can make a difference. We want to make sure that the tools we're giving these individuals are tools that they're actually going to be able to use, that it's actually going to fit with that situation. So in addition to making sure that individuals are recognizing these symptoms of first episode psychosis, we're also trying to make sure that we're reducing the stigma. We're talking about it, right? For so long, I think there's many things that just weren't talked about. And the unknown is what scares us, not being aware, not having the knowledge and information. That can cause, fear. So we're normalizing this. This is a normal conversation to have. There's nothing wrong with having this conversation. Let's be aware. Let's be aware of what this looks like, so that it isn't an unknown. You can go, oh, maybe that's what's going on, and then hopefully, move towards helping the individual. So second, as I said, making sure as many individuals are aware as possible that there is a helpful treatment, a treatment that's out there that can support them. I think that that's just gigantically important. We just want to make sure that we're staying pertinent within people's thoughts. You know, that's one of the whole purposes of the outreach is we're telling you, hey, look, there's this amazing treatment. This is going to help individuals. But we don't want you to forget about us. So guess what? I'm going to call you back in a month. You're going to become my new friend. I'm going to talk with you regularly. I want to make sure I'm staying in the forefront of their mind because I want people to know, just like all of our FEP coordinators do, that there are these programs out there that are going to make a difference. So don't forget about us. So just being that tiny little bug in someone's brain, just constantly reminding them we're still here, and then hoping that by continuing to increase those connections, that's going to help trickle down to everywhere else in the community, and someone will spot something that they might not have noticed before and go, oh my goodness, I think I know what this is, and I think I know what can help them. So thirdly, just to increase the number of individuals that can connected with our FEP and HOPE programs. Early intervention, as we said, is so gigantic. I relate it often to experiences that I had with my own son with autism. It is amazing what early intervention can do. It makes a gigantic difference. And so getting that information out there ahead of time is going to allow these symptoms to be noticed early, and we can get them in early, and we can help get them the support, get them connected, whether it's medication management, whether it's case management, whether it's therapy, just learning how to cope with what they're experiencing and feeling supported, feeling like they have hope and that they're not alone. These are the things that we try and focus on, that we're trying to help get them connected with a treatment that, guess what, you could have a really positive outcome. Like, let's help support you through this. This treatment is here. Let's get connected. Let's get you to the life that it is that you're picturing for yourself. And one of the big things that I look at as far as the importance of getting in early is kind of the idea of increasing behaviors over time, right? If you get an individual in very early in their experience with symptoms such as psychosis with first episode, the more often that they're engaging in the behavior of getting into therapy, getting their medication, taking their medication regularly, these are all behaviors that we're building, right? And the longer you engage in a behavior, the more likely you're going to continue to engage in it. So let's get these individuals in early so that we can help them getting the help right from the beginning, right from the get-go, getting the support they need. It's just going to become one of their behaviors now. They're just going to continue to get the help that they need and continue to seek out and do what they need to do. So I'm very fortunate. I work with some amazing FEP coordinators in the state. I appreciate all of them. Of course, Greater Nashville Mental Health, my home. I love it, and I'm very happy that they do a lot of outreach with the community as well to make sure that there's mental health awareness. I think this year we're having our second Thrive Stride event. It's a 5K run. It's all for helping increase mental health awareness. And I'll be going to that and running, I think. So whatever we can do to get the word out there, that's what our goal is. We want to get our information out there to help support individuals as much as possible. So thank you so much for allowing me to take up your time, and I'm going to pass it on to Lila Austin.
Thanks, Heather. I'm Lila Austin. I am the HOPE team leader at Monadnock Family Services, and I'm going to piggyback a little bit off of what Heather was talking about, and I'm going to talk briefly about the importance of community connections with our folks that are in our program, the clients that we serve. So the community connections, it's an essential portion of our intervention for first episode psychosis. It can help our folks, the clients that we serve, foster a sense of belonging and support throughout recovery while connecting with their communities. It's important to engage individuals in their communities to help reduce isolation and stigma, which can be a barrier to recovery and to treatment. We often see our folks, the clients that we serve, experiencing a lot of social isolation, and that can exacerbate symptoms and slow down their recovery. And so building strong community ties can help reduce that isolation. I'm also going to talk about peer support, because peer support is a big component of the community as well. So our peer support programs and peer support specialists, they're usually people that have a lived experience of mental illness, and so they can offer our clients that we serve some understanding and hope, as well as practical guidance. They can also serve as role models, mentors, and guides, and also demonstrate to our clients that recovery is possible. Peers also can help support in reducing stigma, like we've all talked about here today. They can also help our folks and our clients and loved ones even increase their self-confidence and foster a sense of belonging to their community. Peer support specialists can also help individuals understand their rights and access resources in their communities, as well as advocate for themselves and both in healthcare and community settings. So our peer support here at MFS, she is an integral part of our program. She does a fantastic job of coordinating with our community as well as integrating her own lived experience with our clients here that she sees. She's great for engaging clients. Sometimes clients can have a hard time engaging with clinical staff because oftentimes we don't have that shared experience. So our peer support does a really great job of helping us engage our clients more and getting a better understanding of the clients and helping us meet the clients where they're at. The last little piece I want to talk about for community connections is just the importance of gainful employment with our clients that we serve. Gainful employment can promote not only a meaningful work environment, but it can also help enhance self-esteem and independence and provide structure and purpose to our clients. It also can help our clients with financial independence because a lot of our clients are young, so they might be living at home still or might have to rely on parents or loved ones for financial support. So helping our folks find employment and again, in our community and connecting to the community can help with more increased independence. And again, like I mentioned, employment can help with routine as well as social engagement, which are all positive parts of recovery. Let's see here. So integrating these components that I mentioned, so the peer support, also creating a strong community support network of peers and finding a job and maintaining employment. They're all elements to our coordinated specialty care program. So we have, like I said, we have a peer support individual who specifically works with our HOPE programs. And then we also have a supported employment and education specialist who helps our folks find employment or finish school or go back to school, start college, things of that nature. By having these components of our programs, we are helping individuals with the first episode psychosis to empower themselves and build stronger social networks, develop coping strategies, and work toward long-term recovery in supportive and inclusive environments. And that's all I have. Thank you.
Thank you so much to all of the panelists. You all did an amazing job, and I appreciate all of the information that you've shared with all of us. We do have about 5 minutes. If there are any questions, you can pop them in the Q&A, and we can be sure to answer them. I don't see any in there as of right now, but I'll wait like a minute or two to see if any questions come up. And I do want to thank everyone who came and listened today. It shows that you are interested and you want to learn more about this. So we really appreciate all of you coming.
And as someone who did not have a HOPE program available, Trisha, I see a hand raised there. If you can pop your question in the Q&A, that would be terrific. So no HOPE programs 15 years ago, but there was an ACT team. So when ACT is assertive community treatment, all of the community mental health centers have them. It is a wraparound sort of program as well. I like to say that coordinated specialty care, the model for early psychosis treatment, is like an ACT team, a little bit on steroids because it actually pulls the family members intentionally in. And now peer support, which wasn't initially part of that model, is included as well. So those are important things about coordinated specialty care in the HOPE programs.
There's a question that if the slides will be available from the presentation.
Yes, I will have a
Yeah.
PDF of those, and Ebony will get those connected on the education page of onwardnh.org.
Yeah. And then just the person who had their hand up. There you go. You can either put your question in the chat, or I can, if you'd like to ask it out loud, I can go ahead and just open up here and let you speak if you'd like. Whatever's easiest for you.
Trisha, it looks like you're with us if you want to unmute and ask your question.
To the
Oh,
chat.
she put it in the chat. Perfect. So it says, I work in a school grades 3 to 5. We wanted to contact Mobile Crisis on a student today because of delusions. The parent refused any advice.
Any of you want to take that one? When a parent is refusing services for their child?
Well, I think it might be a really great opportunity to connect with the family. So, obviously they didn't want this to happen. They refused. Maybe they have their reasons. Maybe there's something they're scared of. Maybe they're scared what's going to happen to their child. So maybe as a school, whoever would be most appropriate, whether school counselor, principal, maybe it would be helpful for them to connect with the family and just provide support, not tell them, hey, we need to do this, but say, we want to talk about what happened. What can we do to support you? What is it that happened today? Can we explore it with you? And, I want to make sure that we're supporting you to try and help something like this from not happening again. So that would be my first thing, build rapport and partner with the family as opposed to looking at it like, why are they not working with us? Build a partnership with them, meet them where they're at and see what you can do. That would be my thoughts.
Thank you, Heather.
Yes, I totally agree with what Heather said, and just maybe adding to the perspective, mobile crisis can, if people don't understand it or know about it, can be kind of intimidating, and we're not sure if they understand what mobile is, and maybe the family has some worries or fears that someone's going to come and, take their kid away, or something like that. So really, right, trying to understand what's going on for the family and how you can support them in whatever way is comfortable for them. So,
Thank you, Patty. All right, so we are right at 1 o'clock, so I want to respect everyone's time. Thank you all for joining us today. Just as a reminder, a recording of today's discussion will be posted on the education page of onwardnh.org. You will receive an email in the next couple of days, which will include links for the website along with an evaluation. And Michelle, I can also include your slides in there if you would like. And then once you complete the survey, you'll automatically receive a certificate for attendance. If there are any questions that you did not get answered, please email me at emartin@naminh.org and I can get those questions answered. And we look forward to seeing you at the next webinar. Have a great day and stay warm.